Hello, everyone. First, I just want to thank the center for kind of taking a leadership role in building this community. It's really inspiring. It's kind of like taking a drink from a fire hose, all the data we're getting today. But I'm getting a lot of that out of it, and I'm sure most of us are. So, as you know, my name is Jared, and I love nature and I love numbers, which is why about 5 years ago, with some colleagues, we founded a company called NatureQuant that essentially quantifies nature. And there's many reasons for doing that, but one being a kind of a number file, if you will, is that I feel that measuring things really matters. Obviously, to manage things, you need to measure them, but I actually think beyond that, even the act of measuring something changes its value, right? Think about something as arbitrary as Bitcoin, right? We just start measuring these random numbers and all of a sudden it's worth billions of dollars. And I would say that one of the reasons that the influence of nature in our politics, our economics, even our healthcare is not appropriately kind of incorporated is because it's very hard to quantify, very hard to measure. And so we want to try and solve that with some new technology, not only for research purposes, but also for public promotion as to how nature is really influencing our lives in many ways. So I think this crowd knows a lot about what's happening in our society broadly and kind of the lack of nature exposure that many of us are experiencing. But I think it's worth saying once again that 4 out of 5 Americans now live in urban areas. We spend over 10 hours a day on screens. And according to our data, we spend about 95% of our lives inside or in vehicles. So this is dramatically different than 99.99% of our. It's really a shock to our biology that we're all just accepting. And I think we need to really raise awareness around these new environments, these new behaviors are detrimental to our health. We need to manage that. And the way to manage that, in my opinion, again, is to measure it. I can skip this because I think we've been talking about this all day. I think nature offers tremendous promise in terms of a healthcare intervention. And I think the science is at this point solidified. I don't think that's a bold statement anymore. I think that's kind of an assumption. And I'd like to move beyond that assumption into how do we now apply this knowledge? How do we apply it in our healthcare and again, individually? Like how do we utilize this? There does seem to be kind of a tailwind, if you will, at least I'm seeing one, around the appreciation of nature as a component of wellness. This is the Global Institute of Wellness. They just called nature the fourth pillar of health. So diet, exercise, sleep, and nature. I think that's a little bold. I would say probably the fourth pillar is environment, and nature is just one component of the environment. But obviously, given that I'm hip deep in NatureQuant, it's good to see that, and it's good to see this kind of like public recognition around nature as a wellness tool. So, I warned you I love numbers, so I'm gonna talk a little bit about this study. Many of you may have seen this. So this is actually a meta study. They collected about a dozen studies that all essentially did the same thing. They looked at where people live and they drew a radius around their house and from space analyzed how green it is. And then they looked at their longevity. And what was consistently found, despite whatever confounding factors or covariates that you apply, is that the people that lived in the green neighborhoods simply lived longer. And so, I read this and it just blew my mind that you can look at a neighborhood from space and predict the longevity of the people there just by looking at the trees, right? And so this really inspired me to figure out what's going on. Why are these people living longer? Is it because we're capturing a park by that green measurement and the people are exercising more? Or are we looking at trees, air? Or maybe green is just a proxy for the lack of hazardous built things, right? There's less freeways, there's less factories there because we're seeing green. And so one thing that I thought about, and given my background in data science and machine learning, is if we can aggregate a lot more data than just NDVI and longevity, we can aggregate data around all the natural elements and all of the health events that we can observe that are geotagged and all the other socioeconomic factors into one giant data set, we can really parse apart why these people are living longer, what's going on here. And so that's one thing that we are endeavoring to do, and I'll get into that in a minute. We also are trying to build these statistical models to, not only look at health outcomes, but translate that into actionable economic insight. One of our scientific advisors, Dr. Browning, did a study doing the same thing, looking at where people live, drawing a radius around their house, looking at how green it is, and then comparing that to healthcare expenditures. This was all through a cohort in Northern California, and we find the people that live in the greener neighborhoods, again, despite whatever covariates or other confounding factors you throw at it, are just cheaper to insure. They charge less in terms of healthcare costs. And so we can use this information, promote it widely, and say, look, the ROI on green investments is tremendous. If everyone's $400 cheaper in terms of healthcare services across a million people of a population, planting a tree is one of the best healthcare investments you can make. So we want to build tools to scale that, both in the healthcare infrastructure, in city planning, in real estate, et cetera. So you see these results, and if you're like me, you're inspired, but you're also confused. I mean, this is such a complicated web of elements in terms of human behavior, environmental factors, and you think, how do we parse this all apart? Well, one thing that we can do is look at immediate interventional studies and see what the results are. So, I mean, I like to do this thought experiment where if we just take this room and divide it into two groups, half of us go walk in a park, half of us go walk in an urban environment, we'll find that the group in the park is less stressed. So they have lower cortisol levels, their amygdala activity is decreased. Their immune system is slightly stronger, right? They have higher natural killer cell counts. They're sleeping better, their resting heart rate is lower. If we look at their mental state, they report better mood, they have better memory. There's all of these benefits that we can track. And this evidence has been repeatedly observed through interventional studies. But what I would like to do is kind of take that same thought experiment and scale it across millions of people and across time. And we can do that now with certain mobile technology that we have to understand human behavior and wearable devices to understand certain biomarkers from them. So I'm really excited about kind of finding that mechanism of action. Howard, you had these questions about like five questions, and I'm a data guy, so my answer to everything is more data. So that's what I would like to do. Imagine a world where we know where all the elements are in our environment, and we know how every individual's mental state and physical state is in real time based on where they've been. And we're trying to collect that data so we can parse all of that apart and really find out what are the mechanisms of action, what are the right dosings to optimize human health through nature. Okay, so now I'm going to jump over to some of the technology platforms that we're building to try and solve these problems. There's really two main product suites. The first is what we call NatureScore. And what NatureScore is really a location intelligence. So you pick a static point or area or polygon, and we examine all of the human modifications and natural elements within that static location. So it's really a mapping tool. And the second is NatureDose. And NatureDose is a mobile application that allows for personalized nature prescriptions. And it passively tracks your time indoors, outdoors. And then when you're outdoors, what kind of environment are you in? Are you in a Walmart parking lot or are you in a jungle, right? And so both of these things really rely on collecting massive amounts of data, interpreting that data to then deliver advice or insight into how the nature is influencing many things in our environment, but also our individual health. Let's jump into NatureScore first. So what we've done so far with NatureScore is just for all of North America, we've aggregated over 35 different remote sensing technologies. So these are things like higher resolution satellite imagery with computer vision layered on top of it. So we know where all the trees are, all the bodies of water. We actually know all the park polygons. We know the building footprints, the densities of highways. And then we know a lot of other human modifications like air quality. There was a question about light pollution. We have a data set on light pollution. So what we really have is like a Google Maps, if you will, for nature, down to almost 10-meter resolution in most of our data sets. So you can look at your house and your neighbor's house and you're going to get a different score for what nature is present there. So when you have that dynamic data set of natural elements and you are able to pull in geotagged health outcomes, you can do what I think is very exciting, is run a machine learning process between those two data sets. So if you come to me, you have a data set of 100,000 individuals that got asthma. We look at their addresses, we examine what nature is around there, and we can run a machine learning process that'll give us a predictive algorithm as to what elements of nature seem to be associated with higher or lower rates of asthma. And we are doing this with a number of elements right now, and we're finding really profound results, much like that study I showed you earlier that just looked at green, people live longer. Well, guess what? I mean, there's all other kinds of health outcomes that are very tightly associated with the presence of all these natural elements. So again, in my number guy view, more data we can aggregate, and particularly geotagged health outcomes to compare to this data set, the more powerful this tool will become. So this gives you kind of a little example. We're just looking at two houses here up in Seattle. They're only about like maybe 7 or 8 blocks apart, and they have two different nature scores. And this is a score that was trained on longevity. So we built an algorithm that says, tell me what natural elements is most tightly associated with longevity. And you'll see that the house on the top has a higher score than the house on the bottom. And there are several reasons for that. I mean, obviously, it's closer to a body of water, it's closer to a park. We measure distance to park. The house on the top meets the World Health Organization standard for green space accessibility. The one on the bottom doesn't. And then if you look at the Google Street View, you'll see that the trees are bigger and more mature for the house on the top. The lawns are slightly larger. The house on the bottom is quite close to a freeway. So this kind of precise analysis on address by address can allow us, again, to compare this location intelligence to health outcomes by the people that live in those communities or even in those homes specifically. We also do what are called like city heat maps. We delivered this to Apple to understand where are the nature deficient communities within a city, right? So you're a city park planner or arborist or whatever, and you want to understand which communities have the highest need for more nature. And we can analyze that with high granularity. And you'll see up in the top right corner, Apple's headquarters looks like a park, quite green. You've probably seen pictures of their campus. It's that ring, and it looks like a park. And they're not making it a park because they think it's lovely. They know that it's going to increase the productivity of their employees. It's going to reduce burnout. It's going to increase creativity. And we're seeing that more and more among the private sector, where people are now building green elements into their corporate campuses to improve worker productivity. And so we're trying to kind of obviously help them analyze that and bring what I think is great for the world, better workplace wellness generally. So this next chart really kind of summarizes what we're doing with NatureScore right now. It's probably hard to see, but that little black line is kind of our regression of nature scores, which is across the x-axis, and life expectancy. And as you can see, as nature scores go up, people live longer. And we account for as many covariates as we can, but obviously I'm sure there's a ton we're missing. So take this all with a healthy bit of skepticism, but this is what our statistical models are telling us. And what this allows us to do that's really, I think, powerful is you can now go to a city park department or an arborist and say, you plant 100 trees here, we expect the nature score to go up by X amount. That correlates to longevity increases. And if you want to go one step further and say a human life is worth whatever it is in the US right now, $9 million, you can actually put a price tag on that. So it allows us to build really insightful forecasting tools as to how green infrastructure can influence public health. The other thing I wanted to just point out in this chart that is striking is how steep the curve is in the really nature deficient communities. Meaning that these neighborhoods that have almost no nature see a tremendous benefit from just a small amount of additional green. Whereas the nature rich communities, you can plant as many trees as you want, you won't see it. So we have models like this for longevity, heart disease, cancer, any really health outcome that we have sufficient data for that's geotagged correlate to nature. We're sending data to the White House as well. There's a movement called Justice 40 where they're trying to direct 40% of federal funding to communities of high need. And we're arguing that nature should be one of those elements that they consider to qualify a neighborhood as a high need. So we've really scored every census tract and census block in the US as a potential tool. But we're excited about promoting nature or nature within a community as a critical element of public health. And then we've also analyzed nature against many other things, not just health outcomes. So you can look at air quality, right? How does the presence or lack of certain natural elements correlate with air quality? How does it correlate with urban heat islands? We even have people trying to understand, if I plant trees here, what will it do to the real estate values of all the houses next to these trees, right? That kind of information we can now generate at scale. We've generated nature scores for something like 500 million houses. So this is really a dynamic system. I guess what I'm trying to say, that we're trying to figure out where to apply, and we want to bring in as many partners who are like-minded and kind of using these new statistical approaches, this big data approach to find these connections between Douglas fir trees and air quality. You pick. The other thing we've done is pair our nature score data with socioeconomic factors. So that's this. I think, as we're all aware, the nature deficient communities often have many other disadvantages. So we've paired our data with the area deprivation index, which is an index of 17 socioeconomic factors, to find neighborhoods that are not only nature deficient but generally deprived. And so it's an elegant way to screen for these communities of high need that are also nature deficient. We actually just published a paper, I think it came out 2 weeks ago with Harvard, basically comparing our nature scores by census tract with various socioeconomic factors. And again, this has been done many times. It's not a surprise that the neighborhoods that are generally deprived socioeconomically also have the least amount of nature. But we have a way to really calculate that precisely in its scale. Okay, so that's nature score. Again, that's like a location intelligence tool that's generally static. What I'm super excited about, and what I really think we will be spending the vast majority of our time on going forward, is our new mobile application called Nature Dose. So many of you probably are familiar with the 10,000 step count challenge that Fitbit became quite popular. This is very similar, although the goal you set for yourself is not a number of steps, but it's a number of minutes you spend outdoors, and then also outdoors exposed to natural elements. So it's kind of, I guess, ironic in a way. It's the anti-app app. It's the app that motivates you to get off the screens and go outside. And it passively tracks how much time you've spent outside. It can track, how much time you've spent in parks, on water. And then we aggregate all that data and deliver it back to you to really gamify it, but also just motivate. You might be familiar with this notion of what's called the Hawthorne effect, which is, if you tell someone that you're measuring something about them, they just change their behavior, right? Maybe your doctor says, write down everything you eat. Doesn't tell you what to eat or anything else, just write it down. And you'll find that people just eat a better diet if they're simply writing down what they eat, because it's being measured. And so I think by creating a measurement around time you spend outside, it increases the way people use nature with intentionality, and it motivates them to get outside more. Again, simply by measuring it. But where this gets really exciting is when we pair the data we can generate around who's going outside when, and where they're going, what kind of environments they are in, with other health data, right? So what we're doing now is pairing this data with all kinds of wearable technology. So think about your Apple Watch or many of the other wearables that tell you how long did you sleep, what's your resting heart rate, what's your heart rate variability, what's your body temperature. We can now pair all that data with nature exposure. And what we are finding is pretty, not surprising, but profound. When you go outside for an hour, you do sleep better that night, right? I guess that shouldn't be a surprise, but we didn't have really hard data around that historically. Now we can do that. And we are in a number of clinical trials. I'm just going to talk about one. This is kind of a pilot where we had, I think it was 70 nurses. We had a control group not using the NatureDose app, and then a group of nurses using the app. And we found really dose-dependent improvements. So the nurses that were using the app and getting out the most reported the highest professional quality of life and the least amount of stress. We've also paired our data with what's called heart rate variability, which is kind of a measurement of your nervous system. So how rested and relaxed you are versus stressed out and not prepared for future stress. And we found a very tight correlation there as well. And then I'm going to get super big brother on you. So not to scare you, but we've been struggling with ways to bring Nature Dose into a therapy platform. I think, as we all know, there's a mental health crisis going on, and it's rapidly accelerating, and there's not enough mental health care professionals. So we've partnered with a group that has what's called a digital behavioral monitoring tool, where if you are, and this right now is just being used with at-risk teens, so teens that have a history of self-harm, and your therapist is worried that they only see you once a week or maybe once a month, what happens for the rest of that time, and how do we make sure that this individual is safe? So what this tool does is it monitors their digital behavior. So the sentiment of the language they're typing into their phone, how much are they sleeping, what kind of music are they listening to, are they communicating, are they on phone calls or texts with other people? But what they found is the single biggest trigger or biggest indicator that that individual is about to commit self-harm is they haven't been outside for 3 days. And so what we are trying to do is work with them. And when we see that type of behavior, that someone is in a downward spiral, they're not sleeping, they haven't left the house, trigger them to go get nature dose, trigger them to go to a park and see if that's an effective intervention. So that's, again, it's super invasive, and right now it's only for a small, subset of individuals, but I could see therapy broadly using nature as a very effective tool. We would like to really understand, how do we do that? How do we optimize that intervention? As I mentioned, we are in a bunch of other clinical trials, but excited to do much more. So please reach out if you have any creative ideas. We actually just this week heard from a early result from a study at Clemson that among college kids, the more they got out, the happier they were. Again, not that surprising, but it's great to get data around that. We're also about to start a study where we have 700 students wearing Oura rings, which tracks their sleep every night. And we're going to compare that to their nature dose. So I do think there's a real opportunity to generate this wealth of data into these very sophisticated databases that will deliver really insightful information to us. And I know I look at this kind of in a backwards way. I don't form a hypothesis and then go test it. I just collect as much data as I can and then find out what's interesting in it. So maybe a different approach. We did just make Fast Company next big thing in tech, and I guess I say this partly to brag, but actually I think it's funny that nature is the future when it's something that's so ancient. But beyond that, it's I think a recognition from the tech community that they've been involved in this what's called the attention economy for so long, sucking us into these screens, keeping us indoors, that they're starting to recognize that this is causing harm to society, and they are guilty causing some of that harm. And so I think there's a movement among Silicon Valley-ites, if you will, to create a counterbalance. And we're hoping that our technology can be one of those things that, maybe someday Nature Dose comes on your phone, right? And when they notice that you haven't been outside for a week, they say, oh, hold on, this is too much. Unplug for a minute, go for a walk. So that technology exists. We're excited to potentially scale it through the tech communities, but we'll see how that goes. We've worked with a bunch of partners, a lot of different universities. We're actually partly owned by the University of Oregon. We're somewhat of a spin out from the University of Oregon, but excited to continue to work with, now Texas A&M and Methodist, so that'll be phenomenal, and many other groups. So again, reach out if you have any creative ideas. We can deliver data to you. Yeah, that's it. I'm excited for Q&A. Thank you.